Okay, we're just going to start here on the lower part of your chin.
Not by the hair, on my chinny chin chin. We are here at Laser Aesthetics in Millcroft in Burlington. Okay, I'm ready.
Okay, little zap.
Not feeling anything really.
No, that's good.
Oh, a little bit. Yeah, okay. So laser hair removal is one of the things that they do here. And I'm Eastern European, so I'm not going to say I have a full goatee, but I do have random little tiny hairs on my chin and a bit of a mustache. I don't love it. Makeup gets caught in it. In the summertime, it turns really blonde. It bleaches out. It's more for my personal things, Sue, than it is for anybody else's. Like, nobody can really see it, but I think that's what a lot of clients come to you for.
Well, I think a lot of people, well, most women do have some facial hair that they don't want, really common in the lip and chin area, and hormones can have a big influence on that. So, again, one of these things, we have two different lasers here, one for light skin, one for dark skin. It's all on one platform, so it's really convenient for us. The results and efficacy are amazing. And we recommend that you do probably count on about 8 treatments, and they're spaced 6 weeks apart. So yeah, it takes about almost a year, I would say, in treatment to get rid of this hair. So we're going to go on your lip here. Okay. And we're just going to go across. It's a little, and you can feel a little bit of cool. This laser shoots a little bit of cryogen spray at you, and that's just to cool and protect the skin. There's one side.
You can get this all over your body. Give us some examples.
So most popular areas that we would be treating are, again, lip and chin, underarms, bikini, and legs. We see a lot of gentlemen that come for their nape of their neck. They'll have a haircut.
Oh, interesting.
And it'll grow a little bit quickly, so their haircut will look messy even though they don't need another one, so they'll do the hair on the nape of their neck. Back and shoulders is very popular. The only area that we really can't do is eyebrows, because it can't shape. So that's the only thing we can't do.
That's interesting.
Yeah.
Do you ever do, I know Tim, of course, you know Tim, Poland.
Yeah.
He always complains that he's got hair on his fingers, like his knuckles and stuff.
100%. Like I said, the only area we really...
Sorry, Tim.
And we don't really go up the nose. I mean, we can do the edge of the nose. We can do on top of the ears. They're a little tricky. But the only place that we worry about the scatter of the light where we may actually damage the brow or take too much away, so we stay away from the eyebrows. So now you're done, and just keep your eyes closed and just open slowly. It's a little bright out here. And there you go.
All right, thanks, Sue.
Yeah, and you'll notice that you'll still have hair for about 2 weeks.
Yeah.
The hair is destroyed, but it hasn't come out yet. This doesn't pull the hair out. The hair is dead. It takes 2 weeks for that hair to loosen from its follicle and to come out. So in 2 weeks' time, you'll have no hair. That'll last for about 3 or 4 weeks, and it's time to come back and redo the treatment.
Amazing. Okay, come and see Sue here. She's the owner here at Laser Aesthetics here in the Millcroft region in Burlington. Coming up, we're going to do Botox. We're going to be talking about removing spider veins, and we have a magic chair that helps you do your pelvic floor exercises without you having to do the work. Lots more coming up on Morning Live.
Relax and just hold still. You're going to feel a little wee tiny injection here, just a little pinch.
Botox. A lot of people get it. It's all the rage. It seems to be getting more and more popular. And so I'm thinking that because it's really kind of non-invasive, like it's non-surgical, so that's probably a really popular option for people.
100%. And I think that, a lot of women are kind of looking at ways just to make themselves feel fresh and just to kind of feel better about themselves. And one of these, and it is popular because it works.
Yeah.
Risk is low, downtime is very low, so it's a simple procedure to come in and have. For you right now, we're working on your frown line. So when we look at frowning, what does that do? When we frown, it produces a negative expression. People might say, people look at me and they say, why are you so angry all the time? But I'm not an angry person. So it creates a positive demeanor for you. And people look at you and go, she's happy or she's not doing that. And you actually have quite a little crease coming in between your...
I do.
And
it's because I'm angry all the time, Sue.
and that will get a little more severe as time goes on. So when you start doing a little bit of muscle relaxing here, you're going to stop doing this frown, and then you're going to stop making this line. And that will recover and repair on its own over time.
That's true.
Yeah.
It's true.
Yeah, so we're just going to do another little injection right here.
Okay.
A little wee pinch.
Yeah, I feel it, but it's really not
too
painful at all. No, not at all. It's incredible how easy and quick these types of procedures are.
Yeah. And like I say, very little downtime. Sometimes you'll see a little dot where the injection site was, but most people can come in and go on and carry on with their normal activities and don't really have to worry about it.
And I think we should mention it's not just women that get Botox, men. A lot of men get Botox.
We do see more and more men all the time. And again, you know, people want to just look and feel good. There's two things happening here. And when you feel good about yourself, you kind of go out with a little bit of a more positive outlook on things.
A little bit more with a, you know,
a spring in your step.
Yeah, spring in your step. With a little bit more confidence. Because it's, like you said earlier when we were talking off camera, it's like, it's more about the beauty than, you know, disfiguring.
And
just don't take it too far.
And I think that some people, what they don't maybe understand is that there is a difference between Botox and fillers. We put Botox in to stop muscle contractions that create negative expression or lines. When we look at filler, we're doing filler for people who need volume, where they maybe lost some volume in their cheek, they've lost some volume in their lips. That's when we're going to put a little bit of filler in. And we use Juvederm here. It's a natural hyaluronic acid. It's a very popular. Most people know the name and the brand.
You need that.
Yeah, they're all Health Canada approved. Even with the toxins, there's more and more on the market. They're all good. Everybody who has a Canada Health approved toxin on the market, neurotoxin like Botox, they're all good. They're just a little different. Some of them perform a little differently. So what you need to do is just ask a practitioner, what one's best for you? So here we use both Botox and Xeomin, so we have a couple options. But there, and that's how simple it is.
That's so easy. Now, coming up, we are going to tackle some spider veins that I do have. All of that is coming up. Well, back here at Laser Aesthetics, one of the procedures, whoa! It totally just went away.
It does, doesn't it?
Oh my gosh, that was the craziest thing. Did you see that? Spider veins. A lot of women have them. A lot of men have them. This is one of the procedures that they have here to get rid of them. Sue, explain to me what you're doing here.
So what happens is, you just said, many people have these, and usually it's hereditary.
Yeah.
One of the biggest factors, standing on your job. We want the blood to get back to the heart. It has a little bit of a problem when we have issues. So the blood collects and overflows and creates the spider veins. So what we're doing is we're using a salt solution. We inject it directly into the vein. You can see it flush through the vein. The salt solution is a little irritating to that vein. So what happens is it kind of causes a scar down of the mucosal lining of that vessel. We put a little pressure on it and it shuts that vein down.
That's so cool. I can't believe how fast it goes away. How long does this last for? Is it a permanent?
It's nothing. We hope that.
I know you don't want to use that in this industry, right? Lifetime, permanent.
It's a very, there you go again.
Wow.
It's a very, very hard. It's hard to say permanent, because what happens, you have a problem with your veins, and you talked a little bit about being in the family.
Yeah.
There's little valves that prevent backflow, and your valves are probably weak. So you're always going to have the backflow that causes these. So they can come up somewhere else. Will they come back in the same place? They usually don't, but they can come anywhere, because you're going to age.
I feel like I've had those since I was a teenager.
Yep, 100%.
Like I've had them forever.
So these ones may not come back, but you may find.
I'll probably get more though.
But you may find it as you age.
On the back of my legs, I do have a ton of varicose veins.
So, oh, do you?
Yeah.
So one of the best things that you can do is walk, exercise, walk. Anything that contracts your calf muscle.
Yeah.
It's kind of the second heart to your body. When you contract that calf muscle, it pumps it compresses on your larger vessels and helps the blood flow back to the heart. So exercise, walking, best thing you can do.
And I will tell you that this procedure, not painful at all, and super easy. I mean, super easy.
And one thing we tell people, you have to be a little careful with the sun afterwards. It takes a little time. These little, these little vessels, and just even where we inject, it takes a little while to heal. We look at downtime for about maybe 2 weeks. We don't want you going in hot tubs and jacuzzis.
Right.
It's going to dilate vessels. What are we trying to do?
Showers are okay.
We're trying to shut them down.
Yeah.
Bathing, showering, walking, exercise, all good. A little sun avoidance until they're healed.
All right. Well, thanks so much, Sue. This is super cool. I've never seen anything like this done before.
Amazing.
I'm super fortunate that you were able to do that on me and get rid of my little tiny patch. Coming up, I'm going to be sitting in what I'm going to refer to as a magic chair. You don't want to miss that. Lots more coming up on Morning Live. I've spoken about it a lot. Everybody knows I've had children. I sometimes pee when I jump. I sometimes pee when I do jumping jacks, on the trampoline. As a woman, that is a very common issue.
100%.
Women that have had children. I know it's also an issue for men to have that pressure on their bladder, and then they end up having, bladder control issues.
They can. So what we're dealing with here is we're looking at people who, and it's most people, they can either have, like you said, some kind of leakage when they're doing high impact aerobics, running, jumping, just a busy, active life. We have people who get up at night, so we've got the whole, waking up and disrupting your sleep. We've also got people who have urgency and frequency. So these are very, very common things. So a little leaking, frequency, up at night.
You're saying it much more professional than I am. Sometimes I pee my pants.
But it's a normal thing, and it's really great that we see technology being built around the fact that they're taking care of some of these issues that we maybe didn't talk about.
And this is one piece of it.
And so this is one piece. So this is what we call it's the Emsella chair. EM is for electromagnetic. Sella is Latin for chair.
Okay.
So this is using electromagnetic energy, which is what MRI machines do.
Yep.
And there's these massive magnets in the bottom of this chair that are going to activate the contraction of your muscles. So what we want you to do, and to start the procedure, we're going to do a little setup, because as you can see, you're fully clothed. There's no probes. There's nothing else. You come as you are.
Easy.
We often say to people, maybe don't come in jeans with...
Be comfortable.
Be comfortable,
Yeah.
100%. So what we do is we're going to go into our protocol here to start, and you're going to feel a little ticking. And we want you to place yourself in the middle of the chair so that this little ticking is kind of central. We don't want it up your back. We don't want it on the front of your legs. We want you to kind of rest the perineum on top of the chair where you feel that ticking.
Okay.
Okay, fairly comfortable.
Yep.
You can feel it. You think you're kind of centered?
Yep.
Okay, so now we're going to start. And you're going to feel a little bit of a contracting.
Oh, yeah.
Yeah, the muscle's starting to contract a little bit. And we're going to go up a little bit more so you can see.
Wait, I don't feel like I'm center anymore.
So if you feel like you're not in the center, again, we don't want too much up the back, too much in the front of the legs.
No.
We want you to be centered in that chair. And like you say, you've got your legs nice, your knees apart, and you're rested right on that chair nice and flat.
And Sue, this is kind of imitating me doing Kegels.
So 28 minutes on this machine will be equivalent to 11,000 Kegels. And that's impossible for somebody to do on their own.
As someone who has had to practice those, so impossible.
Impossible. So this bypasses the brain saying, I've got to do it, it does it for you. We recommend, and anybody, there's people who have these issues. There's also the issues that we can prevent some things.
Yeah, preventative.
And if you let things go too long, we're going to get worse. A lot of people use incontinence products because they have these issues and they don't know what to do. Surgery becomes maybe an option down the road, but people don't want it. It's your confidence level. This is what we're trying to help people feel better about themselves, and this can be really treated really, really effectively.
Now, if people want to come in and they want to see you, talk to you, they want to book an appointment, how do they do that?
They can just call Sharon at the office here. I'm sure the phone number, the website, they can look it up and call and book, and we'll do a consultation. There's some limitations. You can't be pregnant. You can't have any metal implants in your hips. So there's a few little exceptions. And no piercing. There's a few little exceptions, but people come in, we have a consult, we talk about whether it's even, something that's going to be a valuable service for them.
Yeah.
But there's a lot of people who deal with this, and it is this is really for your confidence and for just your lifestyle. It's amazing, and we don't want to get worse. Right?
Yeah.
And there's actually some elements of sexual well-being. When we're doing these contractions, we're creating muscular contractions, blood flow to the whole area. So it's not just the pelvic floor. It's doing an abundance of really great things.
All right. Well, thank you so much for having us.
We'll turn you up a little bit and see if you can...
See if I can handle it so much. Thanks again. So Laser Aesthetics, that's the place to be. You can go to their website, make an appointment. Their team here will definitely take care of you. Wow, I'm really feeling this.
Yeah, it's good, eh?
Yeah, it's good, but it's not painful.